He never went to the doctor because he always said he was busy with work and didn't have time. She said, "Doctor, he has been having trouble breathing for 2 weeks and he has chest pain every time he walks to the bathroom."
We understand that atherosclerosis is not something that all of a sudden occurs when you're 40, 50, or 60. This is an accumulation over years and years.
Welcome to your daily health briefing. I'm Dr. Albert Hakim. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Andrew's wife told me we moved here from Delaware 9 months ago. He has high blood pressure, diabetes, he has high cholesterol. He was told that he has some sort of heart disease and advised to keep close tabs with his cardiologist. But after we moved to the DMV, he never went to the doctor because he always said he was busy with work and didn't have time. And, by the way, he tried natural remedies to treat all his problems, so he felt he didn't need the medication. My patient Andrew is 49 years old, moved to the DMV out of state about 11 months prior to meeting me. And the first time I met him, as I walked into the room, he was gasping for breath, couldn't complete a sentence, and his wife was sitting bedside. And I asked his wife, "What is happening?" She said, "Doctor, he has been having trouble breathing for 2 weeks and he has chest pain every time he walks to the bathroom." But he wouldn't go to the doctor because he said, "They just want to give me medicines." Called the ambulance immediately. He was taken to the hospital. Turns out he was having a heart attack and heart failure at the same time. Plus, he was in atrial fibrillation, which is an irregular heartbeat. They took him straight to the OR, where he had 4 cardiac bypasses, all because he stopped taking his medications. So I brought today Dr. Hakim, our resident cardiologist, to explain to us why everyone feels fine until a few seconds before a heart attack. Dr. Hakim, how does a heart attack happen and how could this situation have been prevented?
Dr. Hakim, you bring up an excellent case where you shine a light on the people who have undiagnosed coronary artery disease. It's like an iceberg that has so much underneath it, and the tip of it shows up with a heart attack or a chest pain or heart failure.
You said coronary artery disease, that is blockage in the pipes, in your words.
Coronary is the heart arteries, and atherosclerotic plaque depositing in these arteries leading to events. And so one of the reasons that people get heart attacks is that plaque deposits in behind the lining of the pipe. And the heart, as you know, is squeezing and moving. And so you have not only this energy wave going down the pipe, but the pipe is bending and turning and twisting, and all these motions put strain on the artery, right? And so sometimes this plaque that has developed over years and years and years can become disrupted, and it can form either at the hinge point of where the plaque goes from normal to abnormal. You can get a crack in the plaque, and when it cracks, all of a sudden quickly it can thrombose off, and that can present as a heart attack and the chest pain.
What I understand you is that this was predictable in this
Oftentimes,
case.
the things
He had
don't
high
happen.
blood pressure, diabetes, and high cholesterol.
Yes, all these are what we call the standard modifiable risk factors, the Smurfs. Hypertension, diabetes.
The Smurfs, not the cartoon.
Not the cartoon Smurfs, the standard modifiable risk factors. And then there are other risk factors that are coming along and that we're studying, also going to be modifiable in the future. But we recognize that some people have a predisposition, whether it's because of their genetics, whether it's because of their cholesterol, whether it's because of their diet, whether it's because of their environmental exposure, if they're around certain toxins in the environment that will increase the oxidative stress in their body and lead to acceleration of atherosclerosis. And the big thing nowadays we talk about is inflammation. People who have inflammation in their body, high CRP, is sort of a marker for increased risk for cardiovascular events, even if their LDL cholesterol is normal. If you have a high CRP, that puts you at higher risk for heart attacks and arrhythmia. Because the arrhythmia oftentimes is sort of like we use the word harbinger, but like the canary in the coal mine, that something else is going on, that they have atherosclerotic coronary artery disease.
So let me ask you a simple question, as I would if I were a patient. What actually causes a blockage in an artery? Because I get this question all the time from patients.
It starts early on. The first insult is an oxidative damage stress to the pipe.
Oxidative damage meaning a damage like...
So there's a lining to the artery. The pipe has a lining. And what happens, whether that is smoking, whether it is like an environmental pollution or whatever, you get a damage to the pipe. And the pipe all of a sudden expresses something called ICAM, which is a receptor on the surface that says, hey, we've been hurt, we've been damaged, right? And this damage could have been high blood pressure tearing the pipe or causing strain. And then when you express ICAM, what happens is a white blood cell that started out in your bone marrow and is floating around. This is the FBI in the body, says, hey, there's a problem right there. And so it sticks to it, right? And when it sticks to it, it goes inside, in between the cells behind there to investigate what's going on. This monocyte is the first thing that starts the process of atherosclerosis, because this monocyte takes in cholesterol from the bloodstream. Every time you eat something that comes from an animal or is high in certain lipids, the cholesterol is in the body and gets absorbed in there, and it gets sequestered inside this monocyte that becomes what's called a macrophage, and then it becomes a lipid cell. And this is the plaque that forms in the arteries of the body. And so inflammation is an early culprit in the atherosclerotic process. The immune system is part of what's going on here. So that's why when people have infections, like when they have the flu or something, they're at increased risk of cardiovascular events, because the immune system is talking to each other all over the body. So when you have pneumonia, you're at increased risk of heart attack or a plaque rupture, because the plaque rupture can be from either the blood pressure stress or an erosion of the plaque causing damage to that plaque, and all of a sudden you go from a 20, 30%, 50% to closing the whole pipe off.
So let me ask you a question. At what stage in human development, when you go from being a baby to 80, 90 years old, at what point does the atherosclerosis, that is, this damage to the pipe, start?
Great question, because what they did was, when they looked at these young people who were 18 and 19 dying in Vietnam and dying in Korea, they did autopsy studies, and they looked at their heart and they said, oh my God, the arteries in these 18 and 19-year-olds, they have atherosclerosis. And then they went back.
So that process started at 18, 19?
Even before. Even before. They looked at small children who had died in trauma, and they can see the earliest process of the atherosclerosis, the plaque beginning to form. And the interesting thing is, you don't lose lumen area early on.
Lumen being the size of the
pipe itself. The pipe expands to accommodate the plaque. So you start putting plaque and the pipe gets bigger and bigger and bigger. You don't lose lumen area until 50% of the artery is occupied by plaque, and then you lose lumen area.
This is quite shocking.
That means that
you're telling the guy driving to work right now in the DMV who's 20 years old that he could very well be having atherosclerosis and damage to the pipes right now.
Absolutely. And the thing is, we understand that atherosclerosis is not something that all of a sudden occurs when you're 40, 50, or 60. This is an accumulation over years and years of exposure to, whether it be the smoking or the taking in of any aerosol, things like that, or the high blood pressure or the high cholesterol diet. You know, we all love the yellows of the eggs, and we all love our meat. And we know that red meat has something called TMSO in it that accelerates the atherosclerotic process. And so all of this, it happens from when you're a kid all through your life.
So I, as a patient, I'm overwhelmed now. If a process starts at 18 or 19 and I have a heart attack in my 50s, 60s, or maybe even earlier in my 40s, let's get into the part where we are patient allies as physicians. What can a patient then do? Should they stop eating anything at all at 15, 16, 17? Or what would you tell a patient to start doing in their early years, in their 20s, that would help them in their 50s avoid a heart attack?
We talk about the vulnerable plaque and the vulnerable blood, and you're asking what can a person do early on in their life?
Yes, sir.
Right? So, number one, smoking has now been recognized. It doesn't matter what you smoke, marijuana, cloves, tobacco, a very, very high oxidative stress that can damage the arteries. So we encourage people not to smoke anything. Number two, and that includes the shisha, and that includes the vaping, and
that includes shisha and vaping.
Yes.
Okay.
People they think that, oh, that's not smoking. They think that, oh, it's a bubble water pipe. That's not smoking. Marijuana, no, it is smoking, right? But,
So it's the act of smoking, not what you smoke. It's the act of generating free radicals from smoking that go into your airways.
Exactly. And the second thing is diet. Diet plays such an important role. They talk about the processed foods and you have the foods that people prepare themselves from natural ingredients, right? And then the things that are processed. And more we are beginning to learn about things like microplastics in the environment, and that you can find these things in the atherosclerotic plaque, because when you eat these processed foods, it gets into your system. And when you're eating a high cholesterol meal, whether it be McDonald's food or beef and things like this, this affects the atherosclerosis. But some people are vegetarians, and if you go to India, they don't eat cow, right?
But they still have high rates of
They still get lots of atherosclerosis.
Mm-hmm.
And you could say, well, is that all the air pollution they have in India, all those billions of people growing corn, or is it the inflammation, all the viruses and bacteria that's caused? Because inflammation we now recognize as a big driver of the atherosclerotic process.
But let me give you some pushback there, Dr. Hakim. We also know that the vast majority of cholesterol is made by the body, and that cholesterol from food is a minimal amount. A matter of fact, you cardiologists said that the amount of dietary cholesterol is no longer as important as the cholesterol that the body itself makes.
You're absolutely right. The liver is always making cholesterol, and all the muscles and all the cells in the body are making and using cholesterol. It's part of the body. And the liver puts it into the bile, and it recirculates through the system. But high levels of cholesterol accelerate the plaque deposition in the cells, and then you have oxidized LDL versus non-oxidized LDL, right? And you're right. The body, some people's body is just geared up to make very high levels of cholesterol. And there's like a bell curve, a curve of some people are running around with total cholesterols over 200. Those are the 1%ers, yeah? And some people are also running around with total cholesterols below 100. That's the other 1% on the other end. But the bell curve, most people are running around between 120 to 150 or 180 total cholesterol. Now, we know that if you get that LDL cholesterol lower, what we call it primary prevention in people who have never had events. Yes, you reduce the event rate over time if you get that total cholesterol down. And we have risk models that we use in order to estimate why some people are at higher risk than other people. If you have a couple of the SMRFs, the standard modifiable risk factors, you're more likely to have acceleration of the atherosclerotic event. The interesting thing is we can look nowadays, and we have tools without going inside of your body to look at the plaque and to measure the burden.
That will bring us to another topic, because you're anticipating what we have in store for you, another episode of this podcast, because I think cholesterol deserves a day on its own. So let me ask you something. Let's go back to my patient. He had high blood pressure, diabetes, high cholesterol, and moved here and said he was trying supplements instead of taking his medications that had been prescribed for all 3 big-time risk factors for heart disease. If you had only 30 seconds, and I ask you, Dr. Hakim, is there any supplement that prevents a heart attack in a high-risk patient like my patient? What would your answer be?
All the medicines that we have, many of them came from plants like aspirin. It comes from the bark of a tree. Many of these supplements are biologically active. So aspirin is an anti-inflammatory and it's an antiplatelet. and we use it all the time. Sometimes people get these supplements and you have no idea what's inside of them. They'll say, okay, this is a cortisol or a adrenal supplement, and it'll cause the person's blood pressure to go up because it has cortisol. It has stuff in it that's biologically active. So unfortunately, some of the supplements, we have no idea what's in it or what they do. Many of them are very active. As cardiologists, we use a standard knowledge-based approach problems, and we say, okay,
evidence-based medicine.
We have certain evidence that we try and apply to people. We say, okay, we have goals for hypertension, goals for cholesterol, goals for sugar, goals for inflammation, reducing inflammation in the body. All these things we use to reduce the risk of people having events, because some events are unpredictable. When that guy moves from Delaware here, moving is a huge stressor. When considered one of the 5 big stressors in life. Relationships ending is another big stressor. Children, they can be a huge stressor for you.
But it sounds to me the biggest stressor here is that he should have listened to his wife and taken his medicines.
Absolutely, because it's so easy to reduce the cardiovascular risk with some of these medications that are often very inexpensive. For many people, they get the pills for free and they don't want to take them. They think that, oh, I don't need this. Well, just like the automobile wasn't around 200 years ago or 100 years ago, and it makes our life so much easier, right? These medications, some of them are so simple, we don't realize how far advanced the knowledge has come. And with the simple pill now, a kid doesn't die of infection. In 1945, before penicillin, people would get ear infections and that would kill them. Nowadays we know that some very simple medicines can reduce big events.
Okay, so I'm happy to report that my patient is doing well. He left the hospital, had an ICD placed, had an subsequent echocardiogram show his heart has improved. He lost a ton of weight. He's taking all his medications, a completely different person. And every time I see him, it brings me so much joy, because that's a clear case where somebody turned their life around, trusted conventional medicine, and even looks much better. So as we wrap up this episode, Dr. Hakim, do you have 3 words of wisdom for our patients when it comes to medication non-compliance, that is not taking your medications and having a heart attack or a stroke or atrial fibrillation from them?
All of us are mortal. We are not immortal, right?
Yes.
And so we all have to say, how can we get the most out of life? And these medications that we're using are not there to hurt us, they're to benefit us. And so oftentimes we can extend life, prevent ourselves from having events, prevent ourselves from having problems in the future by taking these pills. And the science behind them is oftentimes very, very strong. With hypertension, in the trials, they will count funerals. You can't fake a funeral. More people are dying with hypertension than with the people with the lower blood pressure. You can say, well, maybe there's something to keeping that pressure lower, And some of these trials have demonstrated not only a heart attack risk, but cardiovascular death, whether it be from arrhythmia or from heart attack.
So you guys heard the expert. If you move and moving is very stressful, make sure you establish care immediately with the local doctor. Make sure there is no interruption in your medications, and find a doctor. Create time, because remember, if you lose your job, you can find another one. If you lose your life, you cannot find another job. All that happened is you lost your job. And guess what is even worse? Your job will quickly find a replacement for you. So make sure you prioritize your life, your health, and your wealth, because health is wealth. Thank you, Dr. Hakim.
Thank you, Dr. Takum.
See you next episode. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takum, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.